You may have seen photos recently, bruised hands, swollen ankles, and the speculation starting to swirl. This following with the confirmation of a medical issue with President Donald Trump. The specific diagnosis, chronic venous insufficiency. But what is it? What is it? And how much of a concern is it for the president? Well, here now, joining us is Payal Kohli. She's a Denver-based cardiologist and founder of Cherry Creek Heart. Welcome to the show, Payal.
Good morning, Chesley. Nice to be here.
All right. Now let's start off with the basics. What exactly is chronic venous insufficiency, and how does it show up in someone's daily life?
So chronic venous insufficiency is exactly how it sounds. It's a chronic condition that's progressive. It involves the veins of the legs, sometimes of the arms as well. And insufficiency means leaky valves. So if you think about our legs, they have sort of two highways: the arteries, which take blood away from the heart, and then the veins that bring blood back to the heart. And over the course of our life, due to being heavy, sedentary, what have you, the leakiness, the valves in the veins that bring blood back start to stretch out, and you start getting leakiness in the veins in the legs. So what you might notice is swelling of the legs, discoloration of the skin, aching legs, swelling when you travel, swelling that gets better when you elevate your legs at night. And for a lot of people, they can even start to get ulcers in later stage of the disease.
Is this just fluid that's leaking, or is this actually blood from your veins that's leaking out?
It's fluid. So
Okay.
the blood pools in the legs, and then because the blood is pooling in the legs, that causes more pressure on the valves. And so you start to, almost like a wet sponge, get some of that fluid from the blood leaking out into the skin. So you can start to see thickening of the skin. When you push your thumb into your shin, you can actually see a dent left behind. These are all signs of chronic venous insufficiency. Now, when we see swelling in the legs, sometimes we also think other things. We think heart failure, congestive heart failure. We want to make sure it's not that, because if the blood is backing up into the legs from the heart, that could be a problem. The kidneys and the liver help us hold on to our blood inside our blood vessels. So kidney disease or liver disease can also cause swelling in the ankles as well. And then blood clots can also cause a blockage in those highways and cause that swelling.
Gotcha. I heard you mention two things. You mentioned heart issue, and then you mentioned circulation. Is it both, or one or the other?
So when it's chronic venous insufficiency, it's not related to the heart. So you rule out the heart, the blood backing up from the heart, you rule out liver disease, you rule out, kidney disease, and then you do an ultrasound of the legs that shows that the blood, instead of coming up towards the heart, is actually going backwards. That's called venous reflux. That's how you make the diagnosis of this condition, when you've ruled out all the other bad things that cause swelling, and you demonstrated an ultrasound that the blood is going in the wrong direction.
Wow. What kind of symptoms could the president be feeling, or someone who is suffering from this, even though he's not admitting discomfort?
Yeah, so in the president, what prompted the testing was a noticeable swelling of his legs. Now, incidentally, they also noticed some bruising on the back of his hands, which is not related to a venous condition. That's something else called senile purpura, which means basically senile as you get older. Purpura means purple discoloration of the skin, because the blood vessels on the back of our hand are very fragile, and as you get older, they can tear very easily. We also know that the president is taking an aspirin every day, which can make you more likely to have bruising and bleeding as well. So that seems to be from trauma, because this is a high traffic area, unrelated to the vein condition in his legs, but he did have swelling in the legs. Now, the White House physician has told us that they've ruled out congestive heart failure with an ultrasound or an echocardiogram of the heart. They've ruled out blood clots as well. They've ruled out a problem with the arteries, which are the highways that carry the blood down. And they've made that diagnosis of chronic venous insufficiency.
Yeah. What kind of treatments would someone go through for this? Can it be stopped or reversed, or you slow it down, or what do you do?
So there's no cure for chronic venous insufficiency. It's a progressive disease, and it's related to genetics, and pregnancies can increase our risk as well. As we get older, we can get it. Smoking can make it worse, but there are treatments. So the most conservative treatments we start with first, which are just compression socks to support the veins so that they're not bulging out and handling all this blood. We do leg elevation, so at least twice a day you should try to elevate your legs up above your heart level. And I would suggest that all of us Americans do that, because this is such a common condition as we get older. 30 to 40% of us over the age of 50 are going to get chronic venous insufficiency. So leg elevation and compression socks. When that doesn't work, they start to do procedures like vein ablations or sclerotherapy, where they actually burn the veins that are leaking to try to sort of prevent that blood from pooling in the legs. Sometimes they'll do a surgery where they actually strip the vein as well. With the president, we're not sure what exactly his treatment plan is, but certainly he has to be on his feet all day. He's got a little extra weight on him, which can increase the pressure on the legs as well. Exercise is huge in trying to help the leg pumps kind of push back that fluid.
All right, Dr. Payal Kohli, Kohli, thanks so much for your insight on this. Thanks so much for joining us today.